to start, and it'll pop up here. All right. So thank you so much for joining me today. I'll let you introduce yourself before we begin our questions, if that's okay.
So I'm John Ellis. I'm one of the hospitalists in Red Deer Regional Hospital. I've been there since the start of the program. I was one of the founders of the program, 2007. And I've been a GP for almost 40 years now.
Wonderful. So could you describe your profession for me? If somebody knew nothing about being a physician or being a GP or a hospitalist, how would you describe that to them?
So medicine is the one thing we have students who rotate through the hospital with us, and some of them are at that critical point where they're realizing that you don't do medicine for the money or for this prestige because it's very hard work, it's very demanding, and basically you're just giving all the time. You're not getting too much back. So you must have a love for medicine and you must have a love to help people. Otherwise, you're not going to survive in the profession. But it's very, very rewarding to yourself. And when you're helping, nursing's pretty much the same kind of thing. You're helping people. And if you're doing that kind of work every day, it's very rewarding. So it's a very rewarding profession, but I think you must really want to do it.
Mm-hmm. Could you describe for our students, they're not familiar with like the role of a hospitalist, what a typical day would look like for you and how truly busy it is?
Right. So in radio, we normally 5-man teams. So there are 5 of us on for an entire week, and we switch on the Monday. So you will start off with rounding because everybody that you admit out of emergency stays with you just because you get to know them when you admit them. So you're rounding on these patients that you've admitted every day. The research shows that the ideal number for a hospitalist is 19, but because then you're kind of comfortable, you've got enough time to see everyone. But in Red Deer, it does not work like that because the patient load is too high. So I've just come off, for example, and I'd actually had 28 patients, and the patients in Red Deer Hospital, because we're a referral center, the patients are a lot more acute and they have multiple pathologies. So when you've got 28 patients, I'm probably there from 8 o'clock to about 6 probably. I normally don't take a lunch break because I'm just trying to get done. So you're basically rounding, looking at results. You've maybe ordered tests, seen if the blood work is getting better, seen if your medication's working, chatting to the patient, just to get an idea how they're doing, chatting to staff about, their interpretation of the patient. So it's a long day, and we're not geographical. We don't each have a ward. Our patients are all over the hospital. So on a normal day, I normally get about 9 to 10,000 steps in, just because going backwards and forwards to the wards. And then every day there's one hospice on call. It's a 24-hour call. It's from 8 in the morning till 8 the next morning, and you will pick up all the admissions in emerge. And if your numbers are high, you can pass them on to the others so that we're all pretty equal. But basically, that's your day, just rounding and seeing your patients.
Mm-hmm. Yeah, and I think sometimes people don't understand the on-call is overnight. So you get woken up in the middle of the night to deal with
Yes,
lots of
yes.
different things, right?
And the thing to remember is if each one of us have that amount of patients. So like I was on call Saturday night, and then you're covering the emerge plus all the hospitalist patients then fall under you from 5 o'clock. So then you're covering like 150 patients. So you get phone calls all night. I have a watch, one of these fancy smartwatches, and it records how much I slept.
Mm.
So on Saturday, in that 24-hour period, I slept 1 hour 29 to give you an idea how busy it is.
Mm-hmm. Yeah, well, we appreciate you. That's a hard job. Um, so can you tell my students what's unique about being a physician in your kind of role?
What is unique? That is a tough question. I think The I know I once read a paper. I was at a conference where they spoke about a paper where it's one of the professions where you make the most decisions in a day and you have to make them reasonably quickly. The only people who were ahead of physicians were air traffic controllers. They have to make a lot of very quick decisions and make the right decisions. In medicine, maybe you've got a little bit of leeway to think a little bit more before you make decisions, but a lot of the time you're making a lot of like really important decisions and you're making them quickly, you're making them on the spot. So, I mean, I think technology's helped us. Before when I qualified, we didn't have cell phones, we didn't even have pages. You had to carry around a little handbook of internal medicine in your pocket or something. Now I can just whip out my phone and quickly look up a flow diagram of how to treat something. So technology has definitely helped the medical profession, including nursing.
Mm-hmm.
So it has made things easier for sure, but it's a very demanding in that you have to make good decisions all day.
Mm-hmm. Lots of decision fatigue, I'm sure.
Yes, absolutely. Yeah. And then I find when I get home, sometimes I'll be sitting at home and suddenly I'll realize, no, I don't think that was right. And then you phone in the hospital quick, no, 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 no. I think this is the way we must go. So it stays in your mind for sure. You don't leave it when you leave the hospital. It goes with you.
Yeah, for sure. So how do you collaborate with nurses or RNs, LPNs, NPs, any kind of nursing?
So I'm one this the I will be honest, I think there's two kinds of physicians. There's the one who's very authoritarian and they're the team lead and everything gets passed down. It's like you sometimes you feel it's not really a two-way relationship. I'm not like that at all. I enjoy the two-way relationship that we all equal, we're all a team. The goodwill of the patient is what's important. So I do my rounds. I maybe spend 15, 20 minutes with that patient, to get a feel where we're at. The nurse has spent, depending on a shift, 8 hours or 12 hours with that patient.
Hmm.
They build up a much better rapport with the patient, and they will be more able to see change in the patient. Whereas I'm seeing them in that little window, 15 minutes in 24 hours. So I really rely on the nurses for that. I normally talk to their nurse first to say, what have you noticed? Blah, blah, blah. Do you think they're getting better? Do you think they're depressed? All this kind of stuff. And the nurses are pretty good at picking that kind of stuff up. And then the patients will often lie to us. I'll ask them, oh, did you eat your breakfast this morning? Oh, yes, and you speak to the nurse. No, the tray was still full. You had one piece of toast, So
Yeah.
the feedback from nurses is incredibly important for us. We're very much dependent on them just because they have much more time with the patient.
Mhm. We definitely spend as nurses the most time with the patients of all the professions, I think.
Absolutely, yeah.
Yeah. So what would you like my first year brand new nursing students who are going to be RNs in the future to know about being a physician and working with physicians in the future?
So I think the thing to remember is like we're all in this together. We're all in it for the good of the patient, but we all have slightly different roles. So when I started training in medicine, my training was initially, the first 3 years is pathology. What does normal look like? What does abnormal look like? So it's picking up signs of abnormality. And then, so in South Africa, I'm from South Africa, so it's a 6-year course. 3 years is spent just science, pathology, so on. The next 3 years is spent on diagnosing, like picking up your diagnostic skills. The way I understood it, nursing is more looking at the normals and picking up clinical signs, not diagnosing,
Hmm.
more just picking up changes, picking up clinical signs. So for me, because our nurses are our eyes on the patient, like 24 hours a day. So for me, it's important for a nurse to be able to pick up signs of change and then relay it. And the other thing is there's never a wrong sign or a wrong comment. If something in your head is telling you, oh, this is not right, just phone the physician and tell them. Even if it's, something to be expected or it's not quite like that, it doesn't matter. Just because it's for the good of the patient. And the majority of physicians will never look down on you if the sign is like an expected sign or it's part of the picture of whatever the diagnosis is.
Mhm.
The majority of us will never look down. I know our hospice group's a very nice group. We will never do that. We'll never look down on anyone who gives us information that we're actually expecting or know about. So I think that's the point, picking up signs. You must be aware of what's normal, what's abnormal, and you must be able to see change.
Mm. That's great. And the students in this course are currently doing their health assessment, so they're learning about that concurrently. So there you go. That's
Yeah, yeah,
perfect.
that is the most important. You must have very good skills in
Yeah,
what's normal and what's abnormal and what's a change. Yeah.
yeah. So my last question is just what do you love about your profession?
Um, I think, you know what? I mean, like I said, I've been almost 40 years, but I probably learn something every day, every week. It's challenging, especially being a hospitalist because the patients are really sick. The emerge docs are sometimes so busy, they haven't quite worked the patient out yet. They know they have to be admitted and they phone you and they don't even give you a diagnosis. They say, no, this guy can't go home. We're not sure why yet, but this and this and this is wrong and we're not sure what the problem is. So it's always a challenge, to get these patients to work out what's wrong and then what's best treatment for them. So I like that every day I get stimulated. It's not a boring job that you're doing the same thing every day. Every day is actually very different, and it's that's international. When you get this degree, you can practice anywhere in the world. So it's kind of nice. It's very portable, and if I had to do it over again, I would do it again for sure.
Oh, that's great. Well, thank you very much. Unless there's anything else you want us to share, I'm happy to end our interview.
No, thank you very much. I'm
Yeah,
glad I
thank you
could
very much.
contribute to their first. Yeah. Okay.
I'll stop the recording.